My son is not huffing Freon.
Mr. Arnold, Dr. House is like a savant when it comes to diagnostics.
What's his genius theory? Because Kenny's not normal? He's doing drugs to deal with his pain?
Maybe the way to look at this is that you are normal.
And what's that supposed to mean?
You're like any other parent who thinks his kid can't be doing drugs.
Doing this because my dad thinks I'm on drugs?
I was doing drugs behind my parents' back at your age, and I had a lot less reason to be. Not that your life must be miserable. But not that I am suggesting that you should be doing drugs. How's school going?
I'm homeschooled.
Really? You're lucky. Going to school was boring.
My dad took me out, and it wasn't because it was boring.
I had a rough time in school, too. Maybe not like you, but, I don't mean to compare our situations. Actually, I guess I am comparing our situations, but only to show you how yours is worse. You can edit that out, right? So I don't look like an idiot?
Relax. Everyone acts like an idiot around me. Makes you think it's not an act. Can I have something for my headache?
Yeah, is that new?
16 years old. It's the same birthday I do.
I'm gonna start the test now. Study showed no signs of scarring in Kenny's heart.
It wasn't drugs.
Well, then give me something better. What's causing heart block?
It could be toxoplasmosis. We should do an LP to test for infection.
It was toxoplasmosis. We'd have seen enlarged lymphs. And because you're not pretty enough to be an idiot, you must know that already, which means you just said it because you want to do an LP to look for intracranial pressure.
Because it is intracranial pressure.
Wait, I'm not done. You thought I wouldn't catch on, which means either you think I'm an idiot, which is flattering. I'm doing my hair differently.
The kid's got headaches. He's been popping acetaminophen like peanuts.
How could you possibly think that I was done? I prefaced that with an either. It needs an or. Or you are an idiot, which is possible. I'm not great at judging men's looks.
The OR?
And the MRI room.
Yes. Dr. House frequently conducts differential diagnoses in a variety of places. He feels that a change in venue often leads to a change in thinking processes. I have to go take care of something else.
Just let me do a CT scan, see if I'm right. The sooner we fix the problem, the sooner we can get to his reconstructive surgery.
Who cares if you're dead? It's how you look. Well, since you've given me nothing better, we're back to drugs.
The one thing we know it's not.
Decreased uptake on the membranous septum.
Could be an artifact. We can redo it, but
Nothing's nothing. Do an EP study.
EP study means we have to stop this kid's heart.
I'll set it up.
House, you have a minute to be disemboweled?
I'm going to thread this catheter through different areas in your heart, and once I found the right pathway, I'll apply some electrical energy.
It'll stop my heart?
It sounds worse than it is. You'll be fine.
Is it gonna hurt?
There'll be some discomfort. If you've done drugs, I understand. Being different's really hard. Kenny, it's more important for you to get better than to worry about getting in trouble.
If I did drugs, that could explain my heart problem?
It could.
And then you can do the surgery to fix my face?
That's why we're here.
You know how famous people, everywhere they go, people are watching them, staring? They never have a chance to just be. You know? And a lot of them turn to drugs. People stare at them because they're beautiful, but me, they just stare.
You okay? I need to know what kind of drugs, Kenny, and how much.
Coke. Mostly a lot of coke. And then when I run out, I usually go to LSD or acid.
Those are the same thing.
They are?
You don't do drugs, do you?
I drank from my dad's liquor cabinet.
We're not going to do this test.
No.
I need you to turn on your side. We need to intubate. I need some help in here.
No tumors in the patient's stomach, so...
The scope caused varicose bleeding. Took 20 minutes of banding to stop it.
Todd was right about the liver failure.
Yeah.
His craniofacial deformity is causing intracranial pressure,
Nope.
which is caused...
Where are the nosebleeds? Where's the labored breathing? You're right about me being wrong. You're wrong about you being right. I need new ideas. Anybody? Does it bother you that this kid's gonna die because you won't put down that camera at all, you know?
You people should be extra motivated. I'm sure they all want to look good in the film.
No, because now they're too worried about looking bad.
Dr. House, heart block plus liver failure could mean autoimmune, maybe scleroderma.
Foreman, does that make sense?
Not without tight skin on the hands, muscle weakness, and a 30-year-old patient.
Liver failure plus heart block could be a mitochondrial disorder.
Hey, see what she just said.
Liver failure plus heart block could be a mitochondrial disorder.
Go look for signs of retinal degeneration.
No, it's ICP. You're only going to see swelling.
Take him with you so he can see the degeneration too.
Lean forward and place your chin on the rest.
I can't reach it.
Scooch in a little.
I'll take care of it.
Just like last time.
Maybe we should try this the old-fashioned way. Okay, look up to the ceiling and try not to blink, okay? Okay, good. Now straight ahead. There it is. Swelling, no degeneration. It's not mitochondrial. Swelling proves there's increased pressure in his brain.
Absolutely.
So now we can schedule the reconstruction.
Absolutely not.
Your test proved you wrong. We found exactly what I predicted we'd find.
Swelling means there's increased pressure. You get a gold star of David for proving, yes, this kid has a big head and big heads cause pressure. It doesn't explain the liver.
Too much acetaminophen does.
JRA explains all of it, including the liver. One theory is better than two. Treat with steroids.
If you're wrong, steroids are going to mess with his immune system, put off his surgery for months.
You really want to lose this argument in front of the camera?
I'll speak to the father. Dr. House believes that Kenny has JRA, juvenile rheumatoid arthritis. We need to start administering steroids.
Will the steroids fix it?
I don't think he has JRA. I think Dr. House is wrong, and that the steroid treatment could be dangerous. I think I can get House thrown off the case and get Kenny the facial surgery he needs.
Didn't think you had the guts to stage a coup.
Coup failed, scheduled for execution at dawn.
No, you're not.
No reprieve from the governor.
You're a test result away from becoming House's front runner. He doesn't care about what you said or what you did 5 minutes ago. He just wants the next good idea. Show me 20% magnification of the forebrain.
I look at our patient. As soon as I saw his face, I saw a regular kid. One thing about being a plastic surgeon, you don't see what is, see what could be.
Talk like that around House. Doesn't matter how many good ideas you come up with.
Wow, you are ugly.
Wow. You're an ass. I have a deformity.
I know. That's why you're ugly. But you're a lucky boy. Anywhere else in the animal kingdom, your parents would have eaten you at birth. Your son needs steroids. Dr. Cuddy agrees.
Does Dr. Taub?
He's not a real doctor. He's a plastic surgeon. All he cares is that your son looks good in his coffin.
So I'm supposed to believe you? A doctor who cares?
You shouldn't care if I care.
I don't trust you.
Because I don't think the surgery's important. You're putting your trust in someone who does think the surgery's important. You're willing to take chances, to risk his life for something he doesn't need.
I do need it. I can't have real relationships. I can't even have a real conversation. Not even with my dad. Dad, I know you love me. But you don't treat me normal. You're always protective. The world can always go to hell. But you never yell at me. Even when I screw up. I want to be normal.
Take your steroids, and you get to live. And you can do your surgery. And it'll only change your face. It won't change who your face made you.